everyone. I'm Wendy Maurer with Cole in the Community, and we are so excited to have Dr. Monica Proud join us today and just share with us what a wealth of information that she has and just what an amazing asset she is in our community. So, Dr. Proud, would you like to just go ahead and tell us a little bit about yourself and your services that you provide?
Hello, Wendy. Thank you for having me today. I'm excited to be here. I'm a pediatric neurologist, and so I see patients and families from birth to young adults, and I treat and evaluate and treat conditions that affect the brain or the muscles, the nerves, conditions like seizures and headaches, epilepsy, weakness, and also conditions of development such as autism and ADHD. And I've been evaluating and treating patients with autism for over 10 years.
Wow. And so what made you go into this area of work, Dr. Proud? What led you into this field?
So I've always had an interest in children and in families and in brain disorders and developmental disorders. And so my passion is to provide support and answers during this very frightening time when something is happening that you're not sure what it is. And so I hope to be able to arm families with guidance and with information so that they can overcome fear and just get things done for their kids.
So with you being pretty much the first responder for early intervention with families coming to you, what are some signs that parents can kind of look at and know when they need to seek out services for developmental pediatricians?
So it's important to know that not any one sign equals autism. But some of the things that I think should be a red flag and get evaluated by a pediatrician is if your child is not speaking or has a speech delay, of course. Also, children that are not pointing and not gesturing by about 15 months is a red flag. Kids that are near between 18 months and 2 years old who don't have stranger danger is a red flag. So you should, by that age, they should clearly not want to be held by a stranger and prefer to be with family. But if they can't discern that, that should be a red flag. And also sort of repetitive play. I mean, some toddlers have very repetitive play, but if they tend to do the same exact thing every time they play, that would be a red flag too.
I like that. I really like how you point out the gesturing and pointing, because so many times we just think of that verbal communication, but
Yes.
that nonverbal communication is just as important. So that's really good to hear. And so I know that sometimes families and parents are really hesitant on getting a diagnosis and not, and not that a label is going to define everything, but can you tell us why it would be important for a family to look at a diagnosis or rule out?
Yes, so no, a label doesn't define everything, but it's important to label a problem because when you can do that, you can have a plan. And if you can't give the name to a problem, you can't give a plan. And so the word autism doesn't describe any one child. What it does is describe a series of developmental concerns and behaviors and symptoms. And those symptoms tend to respond to certain strategies, certain interventions, but you can't get the interventions if you don't name the problem. So I think that's why it's so important.
It is. And so many times, it's the big insurance, that's the thing is we can identify it and really just kind of get that. And what have you seen as far as early intervention why is early intervention so important for children? Whether it's at age 2 or age 8 or age 13, what is early intervention and how can it make a difference?
Yeah, so early intervention just means now, today, as soon as you can. So what I tell parents, and I tell this to myself, and I tell it to just all parents, whenever you have a planning concern, what's the future going to be like? What can you do today that will be the best thing you could do for your kid? And if you do that every day, you'll end up with the best outcome. And so now this immediate action that you can do today will have a better outcome than waiting, for sure. And so, yeah, you can't project into the future and think, well, what school should my kid be in 3rd grade if your kid is 4 years old? If your child is 4 years old, what can you do for your child, for your 4-year-old? What is the best thing that your 4-year-old can get today that will end up placing them where they need to be in 3rd grade?
Yeah. And when we talk about early intervention and with patients and children in general, why is it important that not just the child receive early intervention, that the family also could receive training? And can you explain what that is and how effective that is?
So parent training is so important and is a key component of any good therapy and ABA therapy. And so your child is with a therapist for a certain number of hours a day, but they spend the majority of time in their natural environment at home with you. And so if you can train the parent to almost in part be like a therapist, but also parenting is hard, and parenting a child with developmental disabilities is harder. And so training can provide a parent with the strategies and skill sets that they need to help their child and to help their child blossom and grow and get the most they can out of their therapies.
I love that. And what are some of your favorite resources that you like to share in the community, aside just you being you, offering services? What are some of your great resources that you love?
So my favorite resource for, almost every young kid with autism, but also some of the older kids, is ABA therapy. And there also is something very magical about ABA therapy when it can be combined with speech or OT, because then you can use the strategies of ABA therapy and speech therapy together, and it's this magical combination that works really well. And then other fun things in the community that I love finding, and I think they're hard to find, they're little gems, are those fun resources like, theater and martial arts and camps and stuff. But when they're targeted or modified somehow to also help kids with autism and provide them some social skills, I think that that's pretty magical too.
I love that. We're definitely growing some more inclusive communities in the Houston area. And
Yes.
It's just so neat to see how each year more and more things are being offered. And I know that you're very well connected into helping navigate families and with that. And so can you tell us, what is the process for parents to get to you, and how can they get in touch with you and your services?
So I am a pediatric neurologist with Houston area pediatric neurology. I practice out of an office in Friendswood, which is just south of Houston. And you just have to call and make an appointment. And I'm happy to either see you here in person in a very safe way or by telemedicine.
Very nice. I love how everybody's adjusted for the times like this.
Yeah.
Well, we applaud you for everything that you've done, the work that you do in the Houston community, and diagnosing is definitely still happening during this time. And And so really knowing those signs, and we'll link all your information down below. So, but thank you for joining us today, and we're so happy to have you. Have a great day.
Thank you so much, Wendy. Bye-bye.
Bye.